All right, guys. We're back here with Dr.
He's not going to let you
Holtorf.
talk.
Ever. You can never talk. We want to go over some quick products, go over a few of them. We have a couple of them that we brought today. And then Austin can also talk on what he does. And then we're also going to talk about how we develop protocols and use some oral peptides along with our supplements to enhance outcomes. Right. I guess the first one we'll talk about is fenbendazole. It's pretty popular, right? So anti-parasitic, use it for cancer as well. You don't want me to say that, but
No, I think
can edit
it's
that
fine. We're not promoting any particular product.
we're just talking about
Yeah.
fenben.
And so you tell me about all the studies are coming out. There's not any huge study, right, on ivermectin, which got such a bad rap, and people are realizing that was all BS. But between that and fenben or fenbendazole, very similar. You can talk about how they're
Yeah.
different. But what cancers are they basically getting rid of sometimes or causing regression? What's the percent of success? How much?
Yeah, and it kind of varies because what happens is somebody will say, okay, you're stage 4, you should go get on the Joe Tippin protocol. Have you heard about the puppy wormer? And that's what gets them down the fenbendazole kind of pipeline. And what happens is that as we know, it's never just one thing, right? It's never just one thing, and they're lowering the parasitic load, which often results in greater outcomes of just feeling better. Because as those things breed, that's the ones that are suppressing the tumor pathways. And so if you're lowering that load, and the way this mechanism works in fenben is the microtubules, it cuts off access, and so it's not able to eat.
So it can't divide, right?
Yeah, and it can't get glucose. And so that's the major component of this.
But it doesn't do that to normal cells.
Correct. So it does differentiate, and it can.
And how many different mechanisms do they know of? Of course, and there's always more. And how much of effect is that? Like we see that with like people with Lyme disease or chronic stress, they get cancer because the immune system is low and can't fight the cancer.
Right.
Versus a direct anti-cancer effect.
Yeah, and it comes down to a math problem, right, and into a resource problem. So if you eliminate that with either using ivermectin or fenben, you're going to do a couple of things. You also slow down viral loads. You disrupt the tumor microenvironment, which is key. And then for like ivermectin, there's 5 ways that we highlight it, but one of them is the cancer stem cells stops the circulation. That's why cancer comes back. So if we can take away any part of that, it's if you stayed on ivermectin after they got your cancer out, if you want to go that route and take the mass out, not do the radiation, but get the majority of it out, your success is going to increase drastically.
I think that's the biggest crime, or one of the biggest crimes of standard medicine. For instance, someone gets, let's say, colon cancer. They take it out, chemo, radiation, and they go, oh, you're cured, which means 5 years.
Yeah.
6, 7 years, it's all over. They've killed their natural killer cell function, which monitors the body for cancer. So it sounds like there's multiple mechanisms, right? And what percent of people do you think have cancer have parasites?
All of them. You don't have cancer without parasites, right?
Yep.
And then you're also going to see Epstein-Barr, cytomegalo, candida. If they go get chemo and radiation, they've ruined their receptor sites. They've also induced candida. The pH levels of their body, their nerves are bad and shot. And it's crazy to think that we didn't fix the problem first before we did that. And that's been my proponent is, okay, if we're going to cut on the human, let's make sure that the body's ready for that. And that the trophoblast response isn't so great that the cancer runs, and that we don't have a problem in the mouth, because systemic spread is directly related to the mouth. You're going to have broken teeth, old amalgam, root canals, cavitations. These cause cell pathogen colonization, which causes the leaky gut, which causes systemic spread. And then that's how we get colonization in the liver.
Oh my gosh, I have so many questions for you. Like one thing we look at, if we're all these miracle drugs for cancer so great, why is the rate of cancer just skyrocketing? And we're also not curing it. Or it's like,
Correct.
where we're like the worst, almost one of the worst in the world, and the rate of cancer and how effective we treat it, right?
Yep, correct. And a couple of things that happen there is big food, genetically modified food has exacerbated that. Vaccines. The other thing that is a paradox is that we'll spend $2.5 billion on a cancer drug. And that takes a lot of cancer patients to make your profit back, right? And so that's a failed system.
I think that's put exactly right. We don't want people. We don't want to cure cancer, right? Yeah, you're going to die if you cure
Yeah,
cancer.
if you do,
They're
yeah.
going to they're going to come after
So
you.
what you do is you fix their gut. You put all the bacteria back. We've overused antibiotics out the wazoo, right? And so you have to look at the carbon cycle and what happens when you're missing the microbiota. You're going to have folate problems, folic acid. That's a big methylation debate that's going on right now. But you can look at the research on bacteria and see that there's cyanobacteria that produce B12. There's ones that produce folate, and you can mess up methylation just by not having the right
And
microbiota.
we have more like basically foreign DNA in us than we do human, right? From all the
Well, yeah, and
microbiome.
and then what is interesting is that the body, if again given the right conditions and the right nutrients in a bioavailable form, it starts to wake up, and it's like, oh man, I didn't have the 90 nutrients that I have now, and with the food again, going back to food, and while we're all still sick and hospitals getting bigger, not smaller, the genetically modified wheat,
I
our
love all these things. You hit the nail on the
our
head 3 times.
our body rejects that, right? It's not it again. The bacteria don't know how to digest it. So you'll see the old lady in the nursing home, and they've given her orange juice in the morning and a calcium tablet because she's got weak bones, and then she ate some breakfast that was modified wheat, and it's got pyrites in it, right? So you get calcium, pyrite, pyritic acid, and it's undigestible form of wheat. So the calcium, when the thyroid calls for calcitonin, as you know, it's asking for calcium, and it said it can't get it because so then it's urinated out, which calcified stones in the kidneys, and then little old lady falls, breaks a hip. Well, we don't know. We had her on calcium. Well, did you have her on enough magnesium to
No,
support the
no one should be
calcium?
on calcium
Right, and then if they do, they don't give them enough magnesium, or they're on
or
almond
vitamin
milk.
K. So it just floats around, deposits in the vessels. Instead of vitamin K, drives it in the bones, right?
Correct. And then we're seeing, but going back to the parasitic thing, is the vitamin D receptor, right? It's pretty much just shut.
And don't you like? I think like by the whole big thing that, oh my gosh, vitamin D, vitamin D. But I don't think you should take vitamin D without vitamin K.
Correct. And there's
Otherwise you
other
can.
there's other ones, right? And there's other and we call them cofactors.
And look how basic we are. We're just like so barbaric. From what you're saying, it's what we believe too. Is like everything's so multifactorial, right? But with standard medicine, we have this does this, or even cancer, we're going after this. No, that's not how you do it. What about all this?
Yeah.
Because what is the cause of cancer, right?
Multiple things.
It
It's
is.
the
And if you
summation
had
of life.
this, you wouldn't get it, but you have this, now you get it.
Yep.
Same thing with Lyme. Most people have Lyme disease basically don't have any symptoms because they don't have tons of stress, they don't have toxins, pesticides, plastics. But now everyone's getting it. They think, oh, what's going on? But it's just everyone's too sick to fight it.
Yeah, and you're right. And it just goes back to like the COVID problem. That was an immunity problem. It wasn't that we couldn't beat it. It wasn't so just ultra COVID strain. No, we were not prepared. Our immune systems were not prepared, and that's by design, right? And so that's how the medicine and pharma make money: is they keep you just sick enough so that you keep coming back. And because you have a white coat, you're smarter than me. You're the expert, and I have to listen to you. And they knew that. And so what we do is we tell the doctor, take your coat off, man. You're an American. You're still as smart
They're
as a
not that
whip.
smart. Doctors are not that smart.
Well, you see what I'm saying though.
Yeah,
When you're, they got egos.
I'm telling you.
Hmm.
Like you are so perceptive, and can you talk a little about this quantum neurology that you're doing?
Yes.
Yeah, so the quantum neurology is a neurologic rehabilitation technique.
Because it totally boosts the immune system and cancer. Works for all that.
So I'm sitting down, breaking down the system, and I'm testing every single one of your nerves and the function to the body. So that tells me organ function, that tells me neurologic function, muscular function. I mean, I can go to any part of your brain or what's attached to your brain, and your body guides me in how I'm going to treat it. And so if say your stomach is the problem, you're actually the nerves that go to the stomach are the same nerves that actually go to your quadriceps, L2 nerve. And so
Standard medicine says that's unrelated.
right, 100%. But neurologically, if you have hyperstimulation from the guts or from the stomach that's constantly bombarding the spinal cord and sending information, you have that spinal cord spillover. And so then you have two neurologic pathways that have combined in that same spot, and it's going up to the brain, and the brain goes, I don't know which one it is, so it shuts actually both of them down. So then I get a neurologic weakness that tells me that, yes, it's no longer functioning. And from there, I'm able to actually then sit down and test the different products that we have to see which ones are going to actually boost that system back up, restore function to that area. Your body's so smart, it actually does it like that, and I don't even have to put it in your mouth.
No, it is crazy. And I was like bullshit on all this muscle testing stuff. And And you probably know Klinghardt and up in Seattle, we had a mutual patient. So I flew out there, and I had terrible Lyme at the time, and then he's like, "Oh, you want me to examine you?" I'm like, "Here's my labs." Didn't even look at them. And then he goes, "Yeah, sit here." And he's like, "Oh, you have parotid gland inflammation." Okay, how do you pick that up? I went to an ENT like a month before that saying I couldn't eat anything. I just like spasm. They go, "Oh, you got parotid gland inflammation. Just take antibiotics." I'm like, "I'm on 8 IV antibiotics. What do you want me to take?"
Right.
And he's like, "Oh, whatever." But we had a patient today that just happened to be here, longtime friend, patient, has gone through a lot of issues. Stress has just like been so hard for him, causing so many symptoms. And we've helped him, but it's just he has this underlying like so many issues that becomes super complicated. And I said, "Oh, can you see him? And like, tell us a little about what happened." He was blown away, and he is the biggest skeptic ever. It was, I've seen this, you do this over and over and over and over, but it was very telling. This one case, even.
Yeah. So this patient, I didn't even have to really try to get information out of him. I kind of told him what I did, and he just started, a lot of trauma, as you said, emotional trauma. He trauma dumped on
Oh,
me
so
real
much
hard.
trauma, so much trauma.
And it all started because I literally, so he came in, he was a ballet dancer. So
Yeah, and everybody, just so you know, his feet were like
feet
this.
looked like club feet.
Yeah.
From so many years. And so he
I
rolls.
never noticed that.
Yeah.
We're
So he,
working on everything else. I never noticed that.
and so he's constantly rolling his ankles because his ankles are so weak from the structural deformity from that. And so I was testing him and all the neurologic signs in the feet, which actually led me up into his frontal cortex. And so a lot of that came down to fascial issues, or the fascia being pulled in different areas. So your feet are the bottom of your fascia, the head is the top of the fascia. So the rest of your body in between is a lever. And so it's going to twist and pull based off of where the fascial restrictions are. But if you fix the fascial restriction, say in the middle, but you leave one end or the other end not balanced, that's going to cause a whole lot of issues and dysfunction of the issue. And so, yeah, his feet were super tight and they couldn't let go. But it wasn't until I actually released all the fascia in his mouth, rebalanced his maxillary bone, and then that took almost all of that tension out, and his feet just slightly straightened. Then we had to actually go in, and he had the emotional component. And so
Oh, he was blown away. He was weeping.
Yeah, he was crying.
yeah,
Man, that's
and
crazy.
so I just had him. I did a little bit of NET, which is neuroemotional technique. Actually developed here out in Carlsbad, I think. And but anyway, I did a little bit of NET, access his emotions, and again, I was using muscle testing in order to access neurologic traumas in that situation. And we got down to the nitty gritty of everything emotionally that was bothering him. And then, his feet straightened out the rest of the way. He stood up. I did a little bit of core strengthening stuff with him, and he was walking.
Blown away, and he's went through so much, and he was just like, "This is a miracle."
Yeah.
I mean, and he's not a like foofy guy who's be a ballerina, but no, but he is just like give me proof, give me proof. Like it was unbelievable.
Yeah. And so the last thing he told me was, well, first
Oh,
off,
he
he
could
wanted
hear
to marry
too.
me.
Yeah, you did.
Maybe he's a ballerina. No,
Right.
but he had he hard of hearing. He could hear better. His affect was better. It was like calmer, relaxed. He could just speak instead of like very kind of like me right now. Blah, blah, blah. But it was incredible just change in his whole affect and demeanor.
So your central nervous system controls everything. So if you can correct the brain's communication with the rest of the body, then everything else can fix itself.
And let's talk about one of the probably thought of the most boring fascia. It's thought to be a connective tissue. It's a signaling tissue, and has all these receptors, and it does so much more.
Well, and what they're starting to look at now is that it's actually a crystalline structure, and crystals hold memories. And so a lot of the people that are doing fascial work are actually releasing emotional traumas through the fascial work.
It's like the Jack Black.
Right, and it's instantaneous, like faster than your nerve conduction is how fast the fascial emotional stuff can be.
That's crazy.
Simply amazing, dude. And you had me at the seminar when
Yeah,
you brought the Dr. Suyan up, and you didn't know about her mom's heart condition, and you kept coming back to her heart, and me and Cammie knew, and nobody else in the audience knew. And she had been going all over trying to get the best stem cells for her mom. I mean, she even runs her own exosome clinic, and she was just traveling, and you could tell that was her worry was her mom going to die. But he didn't know that. And as soon as he touched her, he was like, "What the crap?" Right on her heart. was her mom.
So can you tell when people are lying?
Yeah, you can do some muscle testing for
No,
that.
I mean-
Now there is ways to trick it, but
But it's interesting. So it kind of like we're learning that we used to think, well, a lot of people still do, and doctors think everything's genetic, right? And we think, oh, epigenetic, big breakthrough. But we have so many more things. So now, if this is like a memory system, like when you're in utero or all these, when as a child, childhood trauma is devastating, right?
and so what the Chinese did, and this is 10,000 years of research, study, and trial and error, is the Chinese figured out every single organ holds a specific emotion. The solid organs create the emotions. The hollow organs hold the
And we
emotions.
kind of go, oh, that's so cute now, right?
For sure.
Like they know a shitload, right?
Yeah,
But the
it's
best
the
ex-
forgotten formulas, man.
right?
Everything. A lot of what I've learned is reading not just ancient texts, but the history of medicine, going back to Egyptians and how accurate they were, and how that led into alchemy, and then alchemy was the thing until about.
And people think it's just trying to convert metal into gold, right? Yeah.
It's not. And Joan of Arc was an alchemist, and she was crucified for it. She wasn't made into a.
Sounds like the medical board.
Yeah, she wasn't even made into a saint until way after her death, and they gave her sainthood. But that story is tragic. She predicted that they would beat the British off, and they did. And she showed up and fought, and then she was crucified for that. So it's a tragic
They
story.
crucified her
And then the
buddy, yeah.
well, yeah, and then all the druids and all those wizards and
Cathars
but you got to read between the lines. A lot of this stuff worked, like supported like. If you had a bad heart, they'd feed you a young heart. These weren't just things that.
Which now we're doing that again.
Yeah,
Right.
well, and we
100%,
talked about
yeah.
this the other day because we were talking about fecal, right, and fecal transplant specifically. But we would have animals and livestock that would get uncontrollable diarrhea, and it wouldn't stop. It was the nastiest microbe, and it just happens when you're running a lot of livestock. But it teaches you about parasitology and viruses and bacteria. So I would take the healthiest nanny I had. If I couldn't get her to stop, dude, I would take the healthiest nanny I had. I would wait for her. Because goats drop the little rabbit pellets all day long. So you just follow one around long enough to get you a sample. So I had a water bottle, and I put really fresh, good poop in that water bottle. I shook it up, and then I drenched that sick goat with it. And it worked every single time. Within 24 to 48 hours, that nanny was back.
Or to show you, like, we have all these antibiotics with these, like, treatment-resistant infections.
yeah.
And the most cutting-edge thing is putting someone else's
Shit.
crap in their colon.
Healthy crap in there, right?
It's just like it just shows you, like, what are we doing? Whatever our model is wrong.
We've
right?
over-engineered medicine. We've overcomplicated it. And if you simplify it down to gut bacteria, you're a walking, talking microbe, and then eliminating your external factors, obviously, you're trying to. But more importantly, the bioavailability of what you eat. And because we're in America, we're already at a loss, right? And I know this because when we travel out of the country, including with you, I'm sure you can relate to this, is your poop changes. When you get
And all
other
your
people's
symptoms go
food,
away.
It's so weird, right? And within a couple of days of me being in either Mexico or even Panama or anywhere that's not Americanized food, my gut gets better. And I don't even notice it because I'm not really a sick guy, but I do notice a big change in the color.
And I want to mention,
to talk.
is that you said something profound, like ancient wisdom and all these things that I've been saying that as a physician, if you get any specialty, maybe not surgery, but let's say gastroenterology, endocrinology, neurology, but not surgery, that if you go back and look at for 2 months, study all the old literature, you'll be a better specialist than the specialist.
Yes, and you can go back to even the eclectic doctors of America. They named themselves that. And then there was in the history, it's fascinating because you'll have the American Dental Association promoting amalgam against the other group, and they just happened to lose. The other group did. But that was just a fraternal thing.
Or it's like the Infectious Disease Society of America doesn't believe in chronic Lyme.
Yeah.
It's like thousands of studies, la, 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 la.
We'll take it a step further. A lot of Americans don't know that the barber was the bloodletter. He was more of a doctor, and he had the red and white pole for a reason. That's where you went and got your blood let, and that's where you went and got your blood taken. And they would perform surgeries. And guess what? When you wanted to be a doctor, you had to be 17, and you went to like at least a year, sometimes 2, and then you're a doctor. And then a gentleman never washes his hands, Dr. Holtorf.
Yeah.
Same group of idiots, right? And then guess what? Women, babies stop dying. But I'm with you. You look
Isn't that
across the
crazy?
board at America, we have the most money. We're supposed to have the best of the best, and we're ranked
on healthcare.
35th in pregnancy. I mean, everything is shot.
Everyone's
right?
infertile. They're dying. They're
Let me ask,
morbid.
let me ask you a question. Roughly 150,000, 200,000 people die a year of medical malpractice, and no one's in the streets. But Black Lives Matter, White Lives Matter, all these things, right? We pick these weird things as a society, but we ignore the fact that our most trusted people are killing the most people. So why is that?
One of the most
other
dangerous
than
places you
corruption,
can be
but-
is a hospital.
Yeah,
100%.
but what do you think it evolved to that because corporate profits, shareholders have to have results, and that there's no incentive to cure? And now they've built us a model where they've made so many people sick that we've developed an entire organization around root cause. And it's because everyone now.
And I think it's multifactorial, and it's like the whole medical system. And doctors are miserable, but they built a system for themselves. Like they're not incentivized to make you
When do
better.
they get them? Like, when do they get them out of college? Do they get them like right when they graduate to get this shit into them? Like, how do they?
Well, it's like everything. It's just societal, right? And also it goes even down, deep with free speech, and if you're
Debt,
if
like
you're
driving them into
against,
debt too, right? To force their hand.
Yeah,
Does that happen?
100%.
yeah.
Yeah.
But it's funny, like doctors are miserable, and it's funny, and you tell them, like there was a sermo site where they're all like, "This is terrible. We can't do what we want. The insurance companies rule." Well, you let them because you didn't want to take that responsibility. I just want to treat patients. Okay, that's very nice. But now there's a huge incentive. They tell you what to do. And let's say people think you send a patient back to a doctor better, they're going to be happy. No, because if a doctor can't cure it, it doesn't exist, right? And two, that in that system, they can't spend more than 10 minutes with someone, even less. So I almost never will I have a doctor call. Let's say a patient's been sick for 10 years, 20 years, and they go back to their primary care, who they love, and the doctor's very caring, and they're better. And the doctor's like, well, no, that couldn't be it. And like, I think twice I've had a doctor call, like, what did you do? And someone will say, this is ridiculous. It didn't work. I'm like, you rather believe it's a miracle?
Yeah.
And or we have ALS patients in a wheelchair, and they go back and they're jogging, and the neurologist goes, what's a
Impossible.
misdiagnosis? 3 of you? Or a patient will send them back to their primary care, and whatever they had was better. And at actually 1.5 doctors call, and they said, what did you do? And I'm like, explain it. And they're like, why silent? What's wrong? That takes 20 minutes. Yeah, just 20 minutes. I can't take 20 minutes.
So there's
Yeah.
the turn and burn aspect, right? Of just
Right.
the way that
What chiropractors have been doing
set
for
up,
years.
right?
And
How many-
also even medical boards, and RFK's like bringing this out, is that if you're getting patients better, you are at high risk to get a complaint from another doctor, right? Oh, you're making me look
and is that
bad.
because so many kickbacks come with MRIs, and if you order these type of tests, I mean, we see a lot. We
It's
hear a
not
lot of
even-
that
it's-
story.
It's not that straightforward,
Okay.
right? It's that you're taking away their life. You're really showing that they're a bad doctor. And it's kind of like it must not be true because I'm not a bad doctor and I don't know about it, right? But they have no incentive to know about it because they can't do it anyways. So they have this cognitive dissonance, is why they're all so crazy, and they hate what they do. But they instead of changing what they do, they criticize the doctors who are getting patients better.
And they only get like one course in nutrition.
Well,
Like,
yeah.
They don't know anything about it.
Nutrition is bullshit.
Yeah, and
Right.
you don't talk about none of that. The vitamins, the minerals, the selenium, the iodine.
That's pussy medicine.
Yeah, right. And so, kind of answers the thing there is that it's just not the way they're trained, and it comes down to training, and
It's barbaric.
yeah.
And I can't believe, and the medical board are going after doctors. The best doctors I know have left the state and the country, and I get charts from patients from HMOs, and they're just like, "Are you freaking kidding me?" And you say, hey, the patient has this program. You have to order labs. Those are unnecessary. It means they don't even know what the hell they are, right? And they don't care. They're out of solutions.
Yeah.
And most doctors standard doctors have 1, 2, maybe 3, things like, and they don't even know mechanisms anymore.
Well, and don't you think part of the problem is that you're going to the endocrine doctor, you're going to the ear, nose, and foot doctor, and they don't
being
talk.
separated.
They don't
14,
talk. It's
yeah.
the blind leading the blind, right? And then it's like, I'm only going to look at your nasal cavity because that's my
Well,
specialty.
it's the saying from the doctors say, if you have a chronic infection, don't go to infectious disease. If you have an endocrine problem, don't go to an endocrinologist.
Go to the vet or what?
Yeah, or is this because and it's funny, the more specialized, they actually limit themselves to the most narrow cases. So, like, to send someone to a Stanford endocrinologist for thyroid, they have to have a TSH above 10. It's like, that's the freaking simplest case ever. You should be treating the patient with normal levels that are complex. No, it has to be so simple. It's like send them to an oncologist. Do you think they know cancer? They don't know because it doesn't matter. This is the protocol you get when you have this. This is the protocol when they make the diagnosis. You check off the box. Oh, we have a rheumatological thing, and everything's a syndrome now, right? Oh, we have chronic fatigue syndrome. Oh, look, we're smart. We figured this out. Oh, we have nothing for you. So here's an antidepressant.
Yep.
Instead of making them figure out why are they having these symptoms.
Absolutely.
It's giving them an out to be
Yeah.
like the worst doctors get an out.
Sad.
Agreed. And so let me ask you this: how have you handled in the last 20 years, because you've lived it, going from what was it, like 8 vaccines to 46 now for our kids, and you have the development of the peanut allergy, which
You had to bring it up, didn't you?
well, we were a little young, but this whole peanut allergy thing was a big deal. Reading back in the history of it, there was foreigners coming into this country going, "What is this peanut allergy you speak of? We have never had this problem." And they were literally,
because we gave our kids peanuts, and the ones that had allergies, we gave more peanuts. But it's kind of like it was like
it
funny
is
thing.
that way though. But at one point, man, they were going to do away with all peanut butter and all peanuts, and
And you can't have it on planes,
Yeah, and
yeah.
that's the way. That's their philosophy. And it's like, guys, like no.
But you know what's interesting too, is that they're showing that if you have a peanut allergy, but you wouldn't have it if you didn't have these toxins that are binding it and presenting it to these cells.
Right.
So you get rid of that, or like
Or
the big
or
thing in
the
in
Z-Pack.
Texas.
Well, the
in-
Z-Pack thing too. Well, sorry,
in,
that's
or
antibiotics.
in Texas
Measles?
with the Lone Star tick. People are getting the meat allergy,
Mm.
the ones that have been bitten by the Lone Star tick. So it's a toxin that caused the meat allergy.
Dang.
I actually have a friend back at home that had that.
It's horrible.
Yeah.
Okay, I have
his
one
life
for you.
changed forever.
Because I've been curious about your thoughts on this. So we have several doctors that in our group that have committed to a carnivore diet. I would like your thoughts on that and eating nothing but meat every day. And I have no opinion on it.
No,
I'm
you know,
legitimately
and
curious about it.
It's very interesting, and
And why are some people having success, others not?
and I go on a carnivore diet. I just gain weight constantly, right? But also, like everything's all or nothing, right? And it's like all vegetables, but also you get vegetable oxalates and
Yeah.
all the inflammatory things, and meat have all these hormones. So there's like nothing you can really eat, right? But you put anyone on a particular diet, like basically 30% are going to see significant weight loss, and then it's going to go through. But also, I think something in terms of weight, a nice study by Leibel and other ones where they found that if people significantly dieted 3 times, their metabolism and their thyroid dropped, right? And they on average, we test this all the time, based on metabolic rate when someone comes in. On average, 25%. So the 25% lower metabolism because they diet. People go, I wreck my metabolism. They freaking have. But when you go back to normal eating, it doesn't go back to normal unless you do something to fix it.
Right.
Whether that is, T3 is a great thing, but it's like no wonder we're just getting bigger and bigger. Everyone's dieting, and and like the fasting mimic diet. Everything's a double-edged sword, right?
Yeah.
So you're basically increasing the sirtuins and autophagy, but now you've also killed your metabolism, which is also a major thing. So you gotta, but again, most doctors don't look at physiology; they just go good or bad.
Yeah. And that leads
Fire good.
and dude, it leads right into why we both made products the way that we did. Going over your capsules and what you've done with peptides and what we've done with the bioavailability of ours, you knew that you had peptides that were small enough to cross the blood-brain barrier. You needed to get them through the gut. And so, I find it fascinating on, what we've done and what you've created and how that merges
Oh,
together.
it's amazing when we started talking. I'm like, what the hell?
Yeah, I know, right? And so, we looked at it and said, okay, if the body needs 90 nutrients a day, 60 of them it doesn't make, how do we get a patient to comply? And
It's a very good question.
in the big,
And also, I want to be clear that none of these are silver bullet. It's like so many things together. These like totally help the person, but everyone wants, what's the one thing I can take? What's that,
and that's
you
an
know?
American thing, right? And so what we're kind of here to tell you guys is that you can take a few of our products like reds and greens and that vitamin and a few of these peptides. And because you're replacing the 90 nutrients with a bioavailable form and also activating your thymus bioregulators and such, you're going to have greater outcomes in your member care. And that's where I think we shine bright above everyone else, is that you hit these chiropractors up. They've got Cellcore and Supreme Nutrition. It's a bunch of capsules. And if you already have problems and you're sick, you're not digesting that.
Oh, it's capsule overload,
And they just don't take them.
Kind of what you said too. It's though, like, let's say someone has Lyme disease, right? And say, okay, what's causing the fatigue? Well, it's multifactorial. You have this, you get immune dysfunction,
Yeah.
and you get
Emotional.
pineal pituitary dysfunction, mitochondrial dysfunction. You can't detox, and it's like, well, what's causing it? But if you can do either you can try to treat this with 1,000 things. But if you like find a couple key things, now it snaps it back, and now the mitochondria can work. So now that you don't,
Everything starts to come
yeah. So
back.
like, what is really the cause? It's really a
Multifaceted.
misnomer. Yeah.
And that's why it's so important when we do our intakes is that we don't have 10 minutes. We have an hour to go over your birth, your mother, your father, how that relationship was, your brothers and sisters, your traumas. When did you start your period? How many, do you have fever blisters? Do you have, we got to start counting herpes virus subsets, and then knowing cytomegalo is around, knowing that Epstein-Barr was there when she was 3 or he was 3. And then did you get, the worst forms of those? Did you get meningitis? Because a lot of the people in my school didn't, and only one kid got it, and it was because
When we were growing up, I'm older than you, but no one was sick.
no, and
Now I can't go to a party without taking a lab slip.
yeah,
And it's like,
Right.
oh, my daughter, myself, and then but
Everybody.
and then you tell them, well, this. Well, my doctor said that's not it. Well, how's that working for you?
yeah, how's
You
that
know?
working? And those, I guess that, and too, that's the most frustrating clients, I guess, that remembers is that the ones that they start telling you how to treat them, and it's because they've seen so many people that failed, and so then they know everything. Right?
Oh, and I'll bring up, what we started doing, what was very cool. It's kind of like seems old school, is that we're doing roundtables, and
Yeah.
so we got to bring you guys in, especially too. That we have a lot of great new doctors, and our doctors that patients have been everywhere, right? And they're like, oh no, so we can do 1, 2, 3, 4 doctors at a roundtable and live, and we'll videotape it. We'll go through all their labs, and it usually takes like, for instance, my wife goes crazy, but I'm like, oh, I just got one weight loss patient to see. Then 5 hours later, it's
Yeah.
11 o'clock at night, because we're like, oh my God, But we'll have multiple doctors, and it is amazing, the feedback with it. And instead of like most doctors, like I ask people, what did the doctor say? I don't know. He just said, take this, but I don't
Yeah.
know why. But you get totally feedback, and it's just, satisfying because they've been so disappointed. It's kind of like a nocebo seeing a doctor now.
When they say those words like, no one's ever done this to me, or no one's ever asked me that, and that's when you know, man. That's when
And
you
people
know.
cry.
Yeah.
They're like, I haven't done anything. And they're like, crying, you're listening. You believe me. Like, of course I believe you. Like, it says black and white. I'll show you black and white. And like you both, oh my gosh, the cases I know, just from what I know, the patients that personally I know that you guys have treated, it's just like sainthood.
Well, and we don't think of it that way. We really do think of it as just an overall mission of why we were here. And if we come together and we do it, and we just, again,
I'm here because I did a lot of bad things apparently in my previous life.
well, hey,
Right?
but think about all the, and I know you joke, man, but what you've done and the reach that you have has saved so many people. And I think that's why we're on the same mission. That's why the universe threw us all together, is because we're on that same trajectory. And just so kind of everyone's
I'm an
aware,
atheist, but just in case.
I'm here.
Right?
But it was just by chance that we even met. So I don't sleep on things like that, and the chances in the billions that we would even be in Mexico at the same time. And then for you to lecture on peptides, and then us just to go, balls to the wall and know that.
Isn't amazing? It's like meeting so many amazing freaking people, like almost like daily. It's
Yeah,
crazy.
right.
Isn't it wild?
Yeah. blowing my
It's
mind.
just-
Yeah. And it's just kind of like the Amber and them having all that equipment, right? It just, we knew we needed it. We knew we needed those really cool things and somebody to do that. But, and again, it's like, okay, here you go.
Right.
And it's like, wow. And then that led to Dr. Miller and the ozonated glycerin. And, that's probably for another podcast, but he wants to come on. And, this guy's 30 years. He was also a family doctor. He did, he delivered babies. He's done it all. And, we're injecting cancer and things with ozonated glycerin, and we're not scared.
La, 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 la.
Yeah, well, and for this section, for the PMA side, on the
But
private,
you're doing that in Mexico. So.
Yeah, of course. So it's legal, and we can touch on ozonic glycerin another time, but I think, we're all in agreement that if there's a couple of unique things. You get a tough case, you go into the group chat, you got 30 experts right there in their own way that can help and relay information. I want to highlight Scott, Dr. Scott, because, that kid case, the GVHD, it's serious, right? But I wasn't going to turn that down. And that's the pulse of this organization, is that we're at a place now, because we've all come together, that a kid that no one's been able to cure, that's been just
Every
railroaded.
specialist, like, it's so funny. People go, well, we're going to the Mayo Clinic. I'll see you in 2 weeks.
See you in 2 weeks. and it is the truth. And so, but it's giving back, man. And it's like what you're doing with veterans. We met another group of veterans that have a nonprofit, and they're doing big things too. And it's just like, man, when we get them cerebralizing and Cognipep and they're on our protocols, amazing things happen. CTE, TBI, these things go away. These guys can do these.
They've been given up on.
Yeah.
Right? And they're
in the
hopeless.
VA, man, it's just, they hit on it the other day.
That's a whole nother. We got a lot of podcasts to do.
Yeah, well, and there was a guy, the representative from Texas. He's got an eye patch. He was telling Pierce Morgan, like, look, man, the VA needed to lose some people that are just standing around. And he's
Thank
a veteran.
God.
He's a veteran,
God.
and he's like, look, I know the good doctors there. I go there all the time, and he goes, they're pissed. The nurses are pissed because there are a lot of people standing around.
I did a anesthesia rotation at the VA, and it was do not get there before 11, and you get the hell out by 2.
Wow, 11 to 2?
Yeah, and the nurses ruled everything. You do not schedule anything. I remember I was there, and I said, "Oh, give me that pen." She goes, "Not my job."
Wow,
You know?
see, that's
Right.
the problem, right?
But you never piss them off too. You're like be miserable. But
Right.
it's like it's all in the environment. Like they try to do the minimum,
Yeah.
and like is that like a moral thing, or is this in a bad system? But it's a bad system.
Yeah, and I think it's okay.
But there are some good ones. It's very.
And let's not. And again, we're not taking away from the great, because they are out there. Not everybody's bad. Not everybody's good. We get that. But our job is to find the special ones and bring them on. And I think a lot of the doctors that want to do what we're doing, they just don't know where to look. And then they're also
ask both
scared.
You guys. Like there's so many things that if you go to a standard, we have nothing for you. How many illnesses do you have nothing for?
None.
We treat everything.
I can't think of one either.
I mean, everybody can use some form of nutrition in some way, shape, or form.
But not just because,
Yeah.
but it's something that can get them better.
Yeah.
Yeah.
And we know.
And usually dramatically.
Yeah, and we know if we put Humpty Dumpty back a little bit, it'll get us to the next phase of these other ones. We just need to sometimes slow walk that client into this and slowly add the nutrition, slowly detox. And we have milder detox mechanisms to where you're not just disrupting that system to a point where they hurt so bad that they don't even want to talk to you anymore.
And that's like all the like mast cell activation patients.
Yes, love
and
that.
Chronic event response syndrome. And they're very difficult because that what you want to give them, they can't tolerate, right?
Right.
100%.
But what we have found also, let's say our pots and pans, right? And the antibodies to the brain, which almost every one of them have, and pots where all we can't do anything about it, or the neurologists say, that you're getting fatigued because your blood pressure dropped. No, it's the opposite. It's a symptom. But we find, and you get the mast cell doctors, they're brilliant and they just know so much. But all they keep going is that directly after the mast cells. But when you go upstream and work on the pineal, hypothalamic, pituitary, and also the immune system, and for instance, like what we find almost in all of them is they'll have low cortisol and high ACTH. Because the body's trying to raise that cortisol to deal with the stress and the inflammation, but the corticotropin releasing hormone stimulates mast cells like crazy. And so it's very simple. You don't even have to know all the peptide stuff. Give a little touch of physiologic cortisol, not prednisone, and it lowers that CRH. They go, oh my God, now the other stuff works,
Wow.
So it's just kind of like knowing a little physiology instead of just going bam, bam, bam with the bigger hammer. That it works so much better. And I'm sure you guys agree is that small doses of multiple things much better than any huge dose of anything.
Correct. Yeah. I definitely, because you will see like, I'm doing high dose melatonin. Okay. Well, you didn't have to used to do that. So how long are you going to do that? And that's, what
Well, I do.
And
do
then
that,
what's
you
the
know.
effect afterwards?
I get bored.
I
and
mean,
take
I'm
it.
using it as an analogy, but it comes back to the whole.
No, it is like more.
Well, think
Yeah,
about
and
it.
then
It
they
goes
stop
back to
regulating
let's
it.
use psychedelic mushrooms microdosing as an example. If you're constantly having to microdose, you're not fixing the problem. And it's the same thing. It may
Wait.
work,
What? Damn it.
Right. Dang it.
right? It's the same thing.
Kidding.
Yeah, it's not that it doesn't help alleviate symptoms, but you're just giving someone another drug, right? So why are you that way? Let's work on your mental side. Let's get some motivation.
Or you see some of these patients come in on massive doses of so many things. You're looking-
13 on
you-
average,
and-
right? 13 to 19 pills now, 55-year-old and up.
Are you kidding me?
13, bro. That's the average.
It's crazy. Or all these psychiatry. Hello, they don't. Oh my God, they're terrible at it, and they just keep upping meds. And it's like a little bit of thyroid, big difference.
Yeah.
The STAR report, largest study ever done on antidepressants, showed that T3 is a better antidepressant than antidepressants. Bipolar patient, 135 bipolar patients,
Well,
treatment
no,
resistance.
And SSRIs don't work. We've learned that now.
They totally don't. And they actually, they basically had more side effects than effects. But 135 bipolar patients, treatments on average 14 different medications out benefit.
Yeah.
They gave them all T3, even though they were not hypothyroid, according to the lame test. And 85% responded, 30% total resolution of symptoms. They did not have a Prozac deficiency. They did not have,
Right.
Yeah.
Question. So, can you explain just a little bit about how KPV breaks up biofilm, and also you make a really good point that it's one. I think, and excuse me if I don't say this right. Is it 1/1000th or 1/10,000th of a dose of KPV is better than diflucan at its max dose?
So so KPV is very interesting. All the peptides are very interesting, and KPV does look like a bioregulator because they can't find the receptor for it. So bioregulator peptides. So all bioregulators are peptides, but not all peptides are bioregulators. So peptides work on a cell surface. Bioregulators go into the cell, into the nucleus, and work epigenetically, change gene synthesis. But KPV is very interesting because it lowers inflammation, immune modulation, has a lot of different mechanisms, but it also is very directly antimicrobial and antifungal, antibacterial. So at 1/100th the dose, it actually no, I'm sorry, it was 1/1000th. You're right. Of diflucan, it had more antifungal effects than the prescription diflucan, and raised the immune system.
Yeah.
And so probably a dual effect, and also against pathogenic staph at 1/1000th the dose.
Wow. And so comparing antimicrobial peptide LL37 to KPV, do they act differently? Can you just touch on that a little bit in the differentiator?
Oh, they're very, very
of
different.
why you would want to maybe use LL37 in one case, but KPV would be on another.
Oh yeah, like they can be used together. Now KPV totally fine, take long term. LL37 is secreted basically when you have an infection, and it punches holes in the bacterium in the cell wall, in the prokaryotic cell wall, but not a eukaryotic. So it's selective against that. Also increase a lot of inflammatory. So it's kind of like when your body has an infection, you want inflammation, right? Initially. But if your body also, it doesn't basically take care of that infection, and then what happens is you have chronic inflammation, then the immune system starts going into basically T cell exhaustion, senescent cells, immunosenescence, which we can talk about all that. But now it becomes a negative. And what the body do, for instance, you get an infection, the body will wall it off with fibrin. And so you get this immune activation coagulation. So it walls off with fibrin, which is part of the immune system, and then it starts secreting LL37 into that space. So now it's got it all in there, bottled up. But these bacteria, such as Lyme and other ones, they've learned, they wrap themselves in fibrin, they mimic fibrin, they change.
Wow.
And so it becomes ineffective. And now you get all this chronic inflammation. And if you look at the studies, if you get a big burst of immune system and you get rid of it, then it goes back down. But if you don't get rid of it, it just keeps going like this. And that's what we're finding out. Everyone's immune system sucks. So we'll check everyone's immune system, routinely. We'll look at the live blood, right? And we see all their cells are clumped and that. Mine look like
You were showing
chili.
me today, man. Like some of those are gnarly looking.
Oh,
You
it's
see
terrible.
some perfect. You see some
And
really
these are
bad ones.
even so-called healthy people, or those
Yeah.
have that got the jab. Is that their
Is that
cells
what we were
are
seeing
all
in there?
Very
past-
sticky.
Because
Yeah.
it almost looked like there was like, I mean, it looked like a little corona cell in one of those little slides. I'm like, what is that? And that's when I was curious, like the training we talked about. I mean, it's so needed in what we do.
Or I
'cause you
I
talk-
had the doctor send me a slide. Like, look at this; it's pretty amazing. All this, look at all this coagulation. I'm like, oh, I said, where'd you get this Borrelia slide? Like, what are you talking about? And you look, it's just
You saw
Borrelia
it.
in there, and you see it. And they took a film, and it was like floating, and then punched right through the cell wall.
Right.
Mm.
Nami nom.
Wow. Wild, man.
You know what? I do have a question. Like, I hate the term, and my wife says, "Would you stop asking me what kind of doctor are you because you screw it up?" I'm like, I don't know. We do like I'm not I'm not a alternative. Like we're very evidence based. I'm not. What's integrative mean? I don't know. I don't even know what functional is. Isn't that what a doctor's supposed to do? It's just weird. So I started to say I'm a quack, and then they listen.
Oh.
Like, oh, what do you really do? I'm not a quack. Don't listen to me. And they're like, no, tell me.
Right.
Nice.
Same thing
You took
happened
it
with
away.
me when I started working in my little town. The newspaper came down. My patients have called me like a witch doctor, a voodoo doctor forever. The newspaper comes into town. They're like I'm doing my interview. Like they're introducing me as the new doctor in town. I said just by happen chance. Oh yeah, I'm the voodoo doctor in town. And the article comes out. This voodoo doctor's seeing great results. I'm like, well, now I got to own it.
I want that voodoo.
Right.
You went to that voodoo.
So it's very interesting, and I also have the same question. Like people like they don't know what functional medicine doctors call themselves: integrative, alternative, anti-aging, functional, age management. What does all that mean? It's a very good question, and the problem is that it's highly variable. And so many, like there's specialists in standard medicine who go through a very narrow level of education, but you have, I think, such a larger group that are passionate, and so they do go off of like, oh my gosh, we found all these studies, and they do this over here. Does that work, or is it quackery? Well, proof's in the pudding, right? And patients that, and also patients, oh, placebo. No, the patients I see, in fact, we published our data 15 years ago. 500 patients had chronic fatigue and fibromyalgia and likely Lyme, but we didn't. That wasn't a qualifying thing. They saw on average 7.5 physicians before seeing us without improvement, and basically 80% got dramatic improvement. Then we did a multi-center study of 5,000 patients and replicated that. Now I think patients have seen probably 15 doctors
Wow.
before they see us. Do you think when a doctor says something, they're going, "Oh, placebo, oh my God, I'm so much better"?
Yeah.
No, they're like, "Oh, this ain't gonna work again." So it's like, and also with evidence-based medicine, everyone's like evidence-based. We are very, very evidence-based. I've always been, and I still am more than ever. And people say, okay, double-blind placebo-controlled studies, right? Okay, and then meta-analysis. Then you have case-controlled studies. Then you have like case studies, right? Which is, oh, that's just anecdotal. But you know what's worse than a case study? Case studies are very important because you add those all up. People doctors are so lazy. They're like, the ones that are like, oh, I only read what's in JAMA, which is the biggest advertisement thing, and want some big study, and it just gets manipulated. No, but when you add in the small studies that are all independent, that you have much more legitimate evidence, right? But you know what is the worst level of evidence? Are societal guidelines. And they found that the most like strong recommendations from like the Endocrine Society or the Menopause Society are basically have evidence behind them only 19% of the time. And the majority of the time, and they are listed by the WHO as the worst level of evidence. Why? Because they're not based on science, they're based on just basically opinion, and they don't change as studies
how
come
long does
out.
it take 'em to
And
change?
everyone's so biased and have basically a vested interest in this and that. And it's like the infectious disease society doesn't believe in chronic Lyme because that's in their vested interest. It's just crazy. But
So I've kind of read through this. Well, what they're saying is you have to look at functional medicine doctors are going to have a series of fake tests, and a part of those fake tests are going to be toxins, heavy metals, parasites, bacteria, and Lyme. Well, we know that we need those. We know that those
it's
do
a fake
cause.
test when you don't understand
Yeah,
it.
if you don't understand what you're testing for. The other thing is with this one in particular, we've sent poop to vets and got parasitic results that were negative in the traditional side. So I don't.
Oh,
If they're calling that quack, I think, again, this is smart stuff. And, I could argue about this a little bit, but I'm not going to say anyone's a quack if they're legitimately understanding mold and able to test for that. And you could just, again, if I'm sitting there going, hey, buy this little mold test on Amazon, put it on your table for 4 days and tell me what comes out of that. I'm still getting enough information off of that cheap test to know that they're exposed to a lot of mold in their house, at least face value there. It doesn't mean I'm a quack. It means that I know that mold is worse than fungus.
And also we're finding though is people with mold illness, chronic inflammatory response syndrome, that why people go, well, I went in that house and I'm fine. It's people that already have a compromised immune system react to it, but normal people
The
don't.
load is too high.
Yeah.
And that's what, boom. I have so many cases, guys, where they were pregnant and they were exposed to the mold, and then they developed breast cancer, or the kids were chronically ill until they left the house. And then so, mom was getting hit with that the entire time. And so I've had several cases where they had literally tell me on the phone, our last house had mold and we moved to Texas. And, I can't tell you how many times it's told me in relation to cancer, man. Mm-hmm. And I think it's directly, again, related to that. Again, what we talked about, just enough that tips them over. And then just, again, the way that they attack that cancer.
Yeah.
Instead of going back and asking about the freaking mold, right? And
Because they won't. They have their protocol. Or it's funny, we had a patient in California, CEO, never been campaigning. We diagnosed him with Lyme. It was, he was just dying, and we got him dramatically better. But he was very neurotic, tons of trauma, childhood trauma. Mm-hmm. So he went to he was always checking with other doctors, right? And this doctor tells him, infectious disease doctor says, there is no Lyme in California. This doctor's a quack. So he calls, just panic, like, I like you, but oh my God, there's no Lyme in California. How could you diagnose me with this? This is wrong. Well, you are getting better, right? Well, but he says that's just placebo and I'm being scammed. Ugh. And then I calm him down, and then 2 weeks later, or two or 3 weeks later, his dog gets sick, brings him to the vet, and they go, your dog's got Lyme.
Wow. Wow. And you hit it on the head right there, man, is that somebody else told him he was getting better. And regardless if it was placebo or not, it's the power of the brain to believe that you are getting better. And that is what people also don't play into that. Is if I'm a cancer doctor and a oncologist, I tell you got 6 months to live, I just signed your death warrant.
Right.
And that's
but if you can't pay, then you give them 6 more months.
I know, but that's the biggest failure at that level, is telling them how long they have to live. And that, again, what is someone...
You know what? They don't even tell them anything
cause
now.
So much stress to their heart, their cortisol levels, all
and then
that.
me and you have to rinse that off of them.
They don't even tell what kind of cancer the patients have. There's no informed consent.
Here's the best one. Here's the best one: breast cancer diagnosis and not do any hormone panels.
Right.
Go straight to mastectomy.
I have a question for you. I wanted to ask you. I hear that it's very common for a breast cancer patient to have a root canal on the same side as the breast.
Yeah. They actually are doing the infrared, or not infrared, heat signature mapping, and you can literally watch a trail of heat going right down.
I've seen one of those.
Yeah. So your lymphatic ducts in your breasts, you have no muscle. Muscle is what contracts all your lymphatic system the entire time. So if you have
it just drains.
Yeah, it drains right there, and it sits there because it's a bag. And then
we almost bought one of those. I don't know what happened, but yeah.
Well, the same thing that happens with lymphatic fluid. When the lymph goes through the body, it's picking up hitchhikers, man. Mm-hmm. And that's how they travel through the body.
That's crazy. I do want to comment on this. The Institute of Functional Medicine, IFM, was actually started by a shady supplement. So you can tell it's bullshit when they're just like shady supplement seller Jeffrey Bland. We chart disturbing rise of the IFM to revenues of greater than $16 million per year.
And I'm like, that's it?
Like,
right.
No, but they're evil, as these are people like Big Pharma, Big
Billions,
Cancer.
right?
It's like, are you kidding me?
And then have you seen the Purdue opiate documentary? How they brought in oxycodone and did that with the esoteric coding and all that? You got to watch that documentary. It's Purdue University or Purdue Pharma, and it's how they convince.
This is quackery. Look, I'm so happy to do a medical debate, but we don't have those anymore. It comes down to, whatever we do this treatment, you're racist. or whatever.
My
You're a
friends are
quack.
going to back me.
Yeah.
Right.
Yeah.
It's just like hey, this is kind of disgusting. It's just the person whoever wrote this is so ignorant. But also, it's like a saying in medicine: the more adamant a doctor's right, the less they know. Right? It's because they're like, oh, I don't need to learn that. Or I won't tell the long story, but it was a doctor who we were talking about bioidentical hormones, and it was a lawyer friend of mine, and she's like, he's a quack. Da, da, da. He goes, well, there's some studies on that. You haven't looked at those? She goes, I don't need to read the studies. He's a quack.
Wow.
So like right there, it's like, thank you, you know.
Right.
And yeah, I'm like you, man. This is like one of those things where they wrote it with the intentions of not even giving anyone a chance to defend any of
You
these
have the
things.
fake treatments. So for
I mean, how is it if,
yeah,
fake, if
real
it works?
problem like cancer and autism.
But here's the problem is that you don't realize that this is multifaceted and this is a summation of life experiences and carcinogenic exposure. This is likely due to the mother or even vaccines.
Who wrote this?
Tylenol.
It's a user called Lime Science. Their bio is Science Communicator.
Oh, cool.
And also the
them.
the Quack Watch guy, the Quack Watch guy has gotten his ass sued so many times that he is totally funded by the pharmaceutical companies.
Wow.
100%.
And for libel and just like it's amazing.
For sure. And obviously they don't know about vaccine injuries if they haven't read VAERS.
Oh yeah, let's
and
know.
that picks up how many?
Yeah, and I think this was just to spark
Yeah,
conversation.
see, this is just it's
baiting,
not
dude.
it's not even meant to be a discussion.
Yeah, it's just he already has established his opinion. So
Yeah.
Oh,
Wanna do another one?
but this isn't fake news, right? Or it's like, or it was funny. I was doing a PowerPoint on Gamma, and I just wanted to do a thing about the endocrine society, whatever. I said make a secret society, and it blocked. It wouldn't let me upload my PowerPoint.
wow.
I couldn't convert. It says you're passing misinformation and making the endocrine society seem evil. I'm like, what? Like. I just like it's just a joke.
Yeah, we went through that with COVID a lot too. I mean, just crazy. I don't know how many posts we had taken down.
You know the big.
I put a thing out on vitamin D and some other supplements.
like
it was not
using
something we were
vitamin
even
D.
selling.
Vitamin C.
And within 45 minutes, we got an email saying that this is misinformation. Take it down, or we're coming after you.
Facebook jail.
Yeah, it's so stupid, right?
And it freaks you out, right? It was
Yeah.
FTC.
Yeah, and you're and again going back to the how many people die of pharmacies filling their medicine wrong and doctors misprescribing, but yet we can't post that you need to take vitamin C, zinc, and your basic immunity.
And they don't get in
function.
trouble because that is a expected
Dang,
side effect.
Yeah, man.
Well, the CDC
If
and the
we
FDA control
hurt someone,
everything.
we're in shit trouble, right? If they do it and people die all the time, like from surgeries and even cosmetics, we think it's so benign, and meds that oh my god, people have been destroyed. But
Yep. And
Even
I've seen
nothing
the
happens.
cold-hearted nature of some doctors, and you see the prescriptions, and like they don't. They're like those. Sometimes engineers don't have a personality. They're just very, And I see that in some of these other doctors that are just cruel. I mean, when me and Cammie first got together, she took Weston to the doctor, and she came home with all these. I mean, they didn't know it was just like strep, right? And they gave him an eye antibiotic. They gave him amoxicillin,
hepatitis B vaccine when they're born.
Yeah. So, and I just threw all of that, and I just put it away, and made him some DMSO eye drops, and put him on basic stuff, man, and knocked the pink eye out in a day, and we didn't have to take that
Or
stuff. because
also, like
there's a microbiome
all
of the eye.
these, drops for like dry eye, and we find TB4 or TB4 frag and BPC great, and also dripping stem cells or exosomes in the eye.
Yes.
Um,
Game
huge.
changer.
And we have also the retina bioregulator,
Boom.
which, for instance, retinitis pigmentosa. And this isn't like, oh, they seem to see better. They have ophthalmologists, double-blind, placebo-controlled, with the vision map, dramatic improvement, and they have nothing for it.
So-
But they're like, oh, quackery. Oh,
So
all these fake
what's
treatments.
your philosophy? I've had a lot of elderly people have retina detachment, a lot more. do you think it's again deficiencies and things, or it's too
So-
too much medicine, or what's your philosophy
Yeah,
there?
well, retinal detachment is multifactorial. I'm not an ophthalmologist,
Yeah.
but also as you age and you get myopia or presbyopia, is that it makes it more likely. But people with like macular degeneration have great results with it, and they got nothing for it. Yeah, and like retinitis pigmentosa and all these things that are incurable. Don't why are you taking this quack stuff? Like, I can freaking see. Look at the patient we saw today with you had hard of hearing.
Yeah, all I did was
And he's
balance his
like-
feet, and he can hear again.
And stop yelling at me, right?
Uh-huh.
He's like, it's so funny. He's the nicest guy, the funny guy. And he's like, I can hear too.
Yeah.
And he is his whole, like, his cognition was better. He could articulate better. And how long did you spend with him? What?
15 minutes.
And I mean, that's the beautiful part of it. Again, it's like we get to do things that no one else is doing, and we're protected. I mean, this guy walked into Nebraska. What is it?
Nebraska Chiropractic Physicians
Oh,
Association.
how'd you guys meet?
We met through mutual friends, and then and again, this guy showed up every seminar. He did exactly what I asked. He learned. He read exactly what I asked him to read, and then he saw the same things that I did, and he was like, "Holy crap!" And he's really been kind of my poster child for just, if you do this, watch what happens. And he's the first one that really took initiative, because the other ones are so into themselves in their muscle testing. And me and him have had long talks about you're only as good as the muscle tester, okay? And if
that's why I don't do it, because I am, even though
he's the only one I'll let touch me, dude.
I think it's very operator dependent. I don't have that touch. I don't. I'm not a great wine taster. Hot sauce, I need to be punched in the face with it. Like,
Well, and you
I
have to
don't
be
have that
independent.
subtlety.
If you have preconceived thoughts on stuff, and you're going to try to
I have
push a little
preconceived
harder.
thoughts about everything.
Right, 100%.
But at least I know I do.
Yeah, that's true, and that kind of disrupts the quantum side of it, because he's consciously aware of his things, and so I'm interested because in what that looks like at a quantum level for him. But I think we all carry. And I talked to this about Austin because I worry about him in quantum.
He's right here. Don't talk about third person.
Right.
Well, no. I'm worried about you sometimes.
Oh, Austin, the city.
Yeah.
Oh, sorry.
No. This guy. I do worry about him, because here's the reality: is that you don't get something for nothing, and he pulls a lot of trauma out of people, and he carries it. He doesn't realize that he carries a lot of it, and I seen it when he worked on you. Again, you guys both came out sweating.
I have.
And that was in the middle of a seminar.
Like, are we
and
having
like,
sex?
was
Or
real
what we
Yeah, I'm
doing?
like, guys, come on now, like, slow down. Y'all just met. But no, it's just, and I really have encouraged him to detoxify himself, because you can't pull the things that he pulled out today of that man and fix that and not have that
It's like
effect.
Green Mile.
He's bringing it in. Yes, exactly. And that's what when he's having his bad days, that's why. It's because he's carrying the load, dude.
Get a little bitchy, do we?
Right. Well, I don't ever get bitchy. I
No,
just
he really
fatigue.
doesn't. No attitude at all,
and-
but just tired. And I can tell in his voice, man. And I'm like, dude, you need to take care of yourself. And he tells me the same thing. But we're just like you. Is if it takes if it takes 10 days,
I'm
we're
the
gonna
worst
take.
patient. I need to treat myself. I don't.
Well, and when I was here last time, I'm like, bro, come on, we need to get you. And we're bad about it too. But we've also been on each other, and then even Cammy is. Drink this. Just at least drink this, man.
Yeah.
And because we're workaholics, so we feel like if we're not,
I don't exercise. I want to do a shot.
yeah,
Right.
yeah. And so,
But it's interesting when we met and we're talking about things, and like we're talking about the same thing, like a parallel, but we had different ways
went
of
about it
doing
in a different way.
Yeah, we're like,
but we
how
met
do you know
back
that?
up.
We're like, how do you know that?
Yep.
The underlying mechanism where most doctors, it's interesting when there's a drug and you get a pamphlet with it, right? And the mechanism of action is number 12. And the dosing is like, number 2. And they're like, what's the dose? Well, do you know how it works? No. Here's the dose. Right? First, you have to know why it works. And
Yeah.
that's what, and it blows me away.
Yeah, man, and me too. And I knew the first time we met and talked on the phone, that one, we both after that were just like, and you made my day, man. You told me, I talked to a lot of people, man, and he goes, this was the most interesting conversation I've had in a long time. And man, it resonated with me, and it just felt, I was like my brother, right? And same thing with you.
Now I can't get him to be quiet now.
No,
Right.
no, right?
100%. I can never get a
But
word
hey,
in. So
I told, hey, I got your, I did fill out his peptide multiple choice quiz though. And
Oh, yeah, so
did
you
you ever
win.
look at it?
Yeah, I think I don't know the answers, so I think I did well.
Yeah, and so
I haven't checked
I think he
any of
purposely put some tricky ones in there.
No, there are. That's why I said the answers are
Debatable.
they are debatable, right?
Yeah.
Because it's kind of like I failed that damn DMV questions all the time. Like, well, you're too dumb to drive, because I'm like, oh, they're trying to trick us, right? And because there's always a case that where that is true.
Yep.
But in general, right? So there's a lot.
And
of
I
data
even
there.
added one, like I highlighted all of them. I'm like, add another one. And so, but that's what he wanted.
See,
'cause
that's you.
You know, but you know what's beautiful about that? What it made me do, again, just as a refresher, which is brilliant, is I had to go back through all the literature and find where he was pulling those damn questions, because I wasn't going to cheat, dude. I was not going to cheat. I made myself not use AI. I'm like, I'm going to figure this out.
AI's gonna screw
And
it
he
up.
was pulling,
Right.
he was pulling information out of his manual, and I caught on to that, and I'm like, okay, and, yep, and
Quick
then,
search.
yep, no,
But see, I
no,
also I
just
didn't
reading.
want to send it out to people. I wanted the doctors to do it live and think about it, because like you hear a lecture or whatever, like blah 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 blah, and then when it's like, well, what about this? Well, I got to start thinking about mechanism of action. I got to think about what this does, and it's kind of like, I didn't know they did that. Well, I just said it, yesterday.
Yeah.
But they don't remember it. Especially that's why case studies are so great.
And I think that's another reason why we're making the Genius Spots and having them only know our information, is that a doctor can immediately pick that up after he's onboarded and type in any ailment, and it'll tell them the appropriate peptides, including both of ours, right? So injectables and orals, and then do the same thing for IVs. So that way we get a new girl in, and she's not really familiar with DMSO or high dose vitamin C. She just simply texts the Genius Spot. It tells her exactly how to mix that.
And you know what? And there's so many people like working on all these,
Yeah.
bots for protocols. But what happens is it starts getting the general information. It's kind of like,
They're-
take a statin. All these we talk about guidelines that they're wrong.
They're wrong.
And they're going to kill you.
Well, it's like the diabetes protocol, dude. It's a bunch of sugar. It's like crazy.
Oh yeah, and it's like, let's do things to raise insulin.
Yeah, give them orange juice. It's like, okay, man.